Joining us now in the studio. It's so great to have folks back in the studio, and for the benefit of our listeners and those that are watching us on SuperTalk TV, we are socially distanced. We are observing all the proper hygiene protocols. But it's our good friend, John Damon, the CEO of Canopy Children's Solutions. Good morning, John. Thanks for joining us in the studio today.
It's awesome to be with the human. This is fantastic.
I miss those days when we interacted with humans and not through computer screens.
It's fantastic.
It is. So we asked you here this morning because September is Suicide Prevention and also Mental Health Awareness Month. And, of course, your organization, Canopy, is a key player in that respect in the state of Mississippi, in particular to children and families in need of these services. Tell us about that.
Yeah, man. So we've been so honored to step into the lives of families in all 82 counties. With kids struggling from everything needing to be in deep end 24-hour care to kids and families just need a little support and everything in between. And so, the stat that we grapple with all the time and are trying to change is that 1 in 5 kids is struggling all across the state right now. But of those struggling, 4 out of 5 of those never get help. And so, we wouldn't tolerate that in cancer treatment or anything else. So we're constantly trying to drive, because when you don't get help, just like any physical problem, if you don't attend to your toothache, if you don't attend to that earache, it gets worse. Yeah. And those kind of stress fractures become compound fractures that often lead to suicidal, behaviors and that sort of thing. So we're trying to do everything we can to help our families across Mississippi to be healthy. Yeah.
And so I will say, and it's been my honor and pleasure to be a member of the fantastic board of directors we have there at Canopy. And frankly, over the first year or so that I've been on the board, it's been more of a learning experience for me to learn more about the organization, its structure, the services it delivers, and more importantly, the great outcomes that are achieved through those services. But it's a pretty big organization.
Yeah, there's, we laugh sometimes. A lot of people don't know what all we do. We laugh sometimes. We've been around 108 years.
Unbelievable.
And we kind of joke saying, I think our strategic plan was to be super quiet for 105 and then come out really strong. And we don't probably do as good a job talking about that as we should. But, we're the largest nonprofit in the state, save the hospitals.
Right.
We're 18 offices all across Mississippi. We're in all 82 counties. And we serve, about 5,000-6,000 kids a year across the state. Our staff are heroes. I think about this past year, when all these kids that have been struggling, that we've read about in the child welfare system and that sort of thing. We've diverted thousands of kids from entering state custody, and kept these kids and families together. And one thing I really learned about that is families that get just a little bit of help can go a long, long way. We've got a 97-98% success rate of keeping kids and families with confirmed abuse and neglect together and thriving and free of abuse and neglect 2 years following when they get that kind of support that they need. So it's been a real honor, to kind of watch very difficult families and situations who get the kind of, and that's why our logo is a butterfly, right? Society sees some ugly caterpillar moments for some kids, and we go, no, we think they can be something, and we try to wrap that safe cocoon around them to let them grow and develop and struggle and thrive. So.
And it's fair to say that the work there often does. You use the word divert, which is a great word, I think, to describe the outcome, because without that diversion, often these families and the children end up in a dire situation, which becomes then a burden on society overall.
Totally. And you bring such great information about the economic impact in our state.
Right.
Mental health is the research shows now that depression will be the biggest disease cost burden in the world. Autism now is the fastest growing diagnosis in the world. And so what you're seeing is, and this is what, and I'm so grateful to have these kind of conversations, because we all get COVID moment. We all get the need for physical health safety. We often, because of the way we've all been trained and educated, that the Greeks kind of taught us that there's this separation of our brain and our body, this mind-body dualism. And what we know is that's not true, that we're integrated people. And we don't just need to get our health. I had my Healthy You checkup last week. And I'm sitting here thinking, where's the mental health equivalent?
Yeah.
Where's the checkup from the neck up kind of thing? Where is in our mentality that we need to take care of our mental health in the same way we do our physical health? And that's been one of the, if you want to call it glass half full moments of COVID, is everybody's got mental health on their mind. Teachers, schools, businesses, families. They've been reaching out, asking us to come speak. To come kick off before we do anything with our school. The most important thing we're going to do with our students coming back is to attend to their mental health. Because if we don't attend to their mental health, a kid trying to learn algebra could care less about the XY inner slope or anything else if their family's falling apart.
No question. And the same in the workplace. You simply cannot be a productive worker if you're burdened by some sort of mental health problems or problems in the house and what have you. There some stability is necessary there to perform at your fullest potential.
And back to the economic impact of that, it has been clearly demonstrated that when workplaces focus on their employees' mental health, it's not the absenteeism that kills the workplace, bottom line.
Yeah.
It's presenteeism.
Yeah.
It's people who are actually at their desk, who are physically there, but they're mentally not there. They're worried about their parents. They're worried about their mom that's getting put in the nursing home. They're worried about the divorce that's imminent, their kid who's struggling in school. And so you're really seeing, it used to be the HR departments that were really concerned about mental health of their employees. It's the CFOs now.
Yeah, that's a good point.
They are getting that. If I want to increase the productivity of my people, I need to care for my people.
No question.
It's a big change, and I'm encouraged. Been in this a minute, and to see the light bulb going off. And I hate that it takes moments like COVID and some other things to get people to kind of start normalizing and attacking the stigma of mental health. But there's more discussion than I've ever seen in the business sector, in the education sector, all across healthcare sector, talking about how we need to integrate mental health and physical health. So I'm really excited and hopeful.
And so this month being Suicide Prevention and Mental Health Awareness Month, what exactly is Canopy doing along those lines?
Man, we have some really neat programs that we have partnered with some great folks to try to lift that stigma of mental health. Well, the CDC's done a new research. The suicide ideation right now is at its all-time high ever. And so what we want to do is try to create conversations to open up the dialogue in families, to open up the dialogue in business, to make it okay to not be okay, but also to say it's not okay to stay there.
Right.
And how do we take that? You feeling a 1 on a scale of 1 to 10? How do we get to 2? Let's talk about it.
Yeah.
And so we've partnered with Trustmark Bank to do this Shine the Light on mental health. And we've got, 2-time Pulitzer finalist Marshall Ramsey, who's done some great artwork and some PR pieces that we're putting out, commercials that we'll be running to really drive this stigma discussion and say, hey, let's shine the light on mental health. So that's one thing. There's many others, but we're excited about changing the narrative.
Yeah. John, so great for you to come in today. And the work you guys do, I continue to be impressed with the fantastic organization, the quality of its work, the commitment of its staff. They truly do have a passion for what they do, and folks need to know that it's a gem in our state. And thank you for your leadership.
And thank you, Gerard, for your stalwart leadership. And as you know, we got the best brain trust on the planet.
No question about it.
We're grateful that kids and families are getting better because of this great leadership.
No question. John Damon, the CEO of Canopy Children's Solutions, thanks for coming in today. We'll talk soon, John. Thanks.
Thank you, Gerard.